Good morning, dear students. Would like to make a short video on the bones of the upper limb. At the end of the session, the students will be able to demonstrate the upper limb bones, to explain about the bones of the upper limb in detail, like the clavicle, scapula, humerus, ulna, radius, the carpal bones, metacarpal bones and phalanges. The bones of the upper limb consist of the clavicle and the scapula. As you can see in the picture here, this is the clavicle, okay, and the scapula, which forms the skeleton of the shoulder. The humerus in the arm. Arm is described as the region between the shoulder joint and the elbow joint. Arm is between shoulder joint and elbow joint. So it is formed of the bone humerus. And radius and ulna in the forearm. In the forearm is the region between the elbow joint and the wrist joint. Elbow joint and the wrist joint. Okay. So here you can see the elbow joint and you can see the wrist joint. The bones in the forearm are radius and ulna. Radius is a lateral bone and ulna is a medial bone. The bones of the hand consist of carpals. From proximal to distal are carpals, metacarpals and phalanges. How many of them? There are 8 carpal bones, there are 5 metacarpal bones and there are 14 phalanges. 14 phalanges. Okay. Now we'll see detail about each bone. We start with the clavicle. This is the right clavicle. It has 2 surfaces, the superior surface and the inferior surface. I will talk about the detail on the superior surface. The superior surface shows 2 ends. This is the sternal end. This one is the sternal end, which can also be called as the medial end. Okay, it is the medial end, sternal end, and acromial end, which is the lateral end. Acromial end is the lateral end. The medial end is quadrangular. If you will feel this, it is quadrangular in shape, and the lateral end is flat. Lateral end is flat. Medial two-third is convex anteriorly. It is convex anteriorly, and lateral 1/3 is concave anteriorly. Okay, lateral 1/3 is concave anteriorly. So the junction between the medial 2/3 and lateral 1/3. Okay, the junction between medial 2/3 and the lateral 1/3. This is the weakest point of the clavicle. This is called as the weakest point of the clavicle. So it is very common to have fractures at this point. So actually what happens is the architecture of the bone changes. So from here to here, if you notice, it will be quadrangular, like quadrangular, and here it becomes more flat. It becomes more flat. Okay, so this is, remember, this junction between medial 2/3 and lateral 1/3 is the weakest point. So it's a common site of fracture of the clavicle. The clavicle also has the body, which is also called a shaft. It is the only bone which lies horizontally, long bone which lies horizontally in the body. It has few other features. It has membranous ossification, and it can be pierced by nerves, namely supraclavicular nerve. Coming to the inferior surface, again look for the medial side, which is the sternal end, okay, and the lateral side, which is the acromial end. Okay, Now close to the lateral side, we have the trapezoid line. This is called as the trapezoid line, okay, and look for the conoid tubercle, conoid tubercle. And in the shaft inferior aspect, you can look for the subclavian groove. Subclavian groove, it is for the subclavius muscle. It is for the subclavius muscle. And medially, look for the impression for costoclavicular ligament. Impression for costoclavicular ligament. So here you can also see there is a facet over here. It's called the sternal facet, and on this side it is called as the acromial facet. Okay, the reason why we have these facets is because it's going to form a joint. Okay, we'll see it in the next. So the articulation of the clavicle, that is, what are the joints which are formed by the clavicle? Medially, it forms the sternoclavicular joint. Okay, so as you can see, this is the clavicle over here. Okay, and medially it is forming this joint. So this is the sternoclavicular joint. That's why it has the sternal facet in the clavicle, medial end of the clavicle. In the lateral end of the clavicle, it has an acromial facet. It has an acromial facet. It forms the acromioclavicular joint. Acromioclavicular joint. Okay. Okay. Now coming to scapula. The scapula has many features. It is a irregular bone. It is flat. It is flat and it is irregular bone. It has 3 borders. Okay, you can see the borders. This is called as the lateral border. This will be called as the medial border, and this is called as the superior border. This is actually belonging to the right side. This is the right scapula. It has 3 angles. It has 3 angles, which is called as the superior angle. You can see here, this is the superior angle. This is the inferior angle over here. And then you have the medial angle. Okay, this medial angle, sorry, not the medial, it is the lateral angle. Lateral angle is replaced by the name glenoid cavity. Okay, so this is the lateral angle over here, which is replaced by glenoid cavity. So there are 3 angles: superior angle, inferior angle, and laterally it is called glenoid cavity. Glenoid cavity. Okay. Now coming to surfaces. Okay, it has 2 surfaces. It has 2 surfaces. This surface which you are seeing here, this surface is called as costal surface. Okay, it is called as the costal surface because it will be lying over the ribs. Okay, so it's called as the costal surface. And the one on the other side is called as the dorsal surface. Costal surface and the dorsal surface. On the other side, inshallah, next picture we can see it. So let me quickly go through. There are 3 borders. It was the superior border, the medial border, and the lateral border. There were 3 angles: superior angle, inferior angle, and laterally it is the glenoid cavity. There are 2 surfaces: costal surface and the dorsal surface. There are 3 processes. What are the names? It is the Coracoid process. Okay, you can see here, this is the Coracoid process over here, this one. Okay, then this is called as the Acromion process. Okay, Acromion process, and the Spinous process, which is not seen in this view. We can see it in the next view. Okay, so there are 3 processes: Coracoid process, Acromion process, and Spinous process. Okay, now I will move on to the next. Okay, now you can see the same, it is the right sided scapula and it is the posterior view. So the name of this surface will be the dorsal surface. It is the dorsal surface. Okay, so again we have three angles: superior angle, inferior angle, and laterally it was the glenoid cavity, glenoid fossa. Okay, and three borders. This is the medial border, the lateral border, and this will be the superior border, the superior border. Okay, and we said about two surfaces. The anterior one is called as costal surface, the posterior one is called as the dorsal surface. There are three processes, namely this one is the Coracoid process. Okay, Coracoid process. This is the Acromion process, and this one is the Spinous process, or it's also called as the spine of the scapula. Okay, so spine of the scapula. So spine of the scapula, it continues to form the Acromion process. Okay, so if you continue on along the spinous process, you will find the Acromion process. The coracoid process can be found along the superior border. If you trace along the superior border, you will find the coracoid process. Okay, now there is another three fossas related. Okay, so what do you mean by fossa? It is a depression. So the three fossas are supraspinous fossa. Okay, so remember the spine of the scapula is dividing it into two parts. Okay, so you can say supraspinous fossa, and the one below the spine is more infraspinous fossa. Okay, supraspinous fossa and infraspinous fossa, and on the other side it was the subscapular fossa. On the anterior aspect it was the subscapular fossa. Okay, now we have two notches. Okay, so here the name of this notch over here, if you run your finger along the superior border, you will come across this notch. The name of this notch will be suprascapular notch. Okay, suprascapular notch. Okay, the meaning is it is along the superior border, so it's called suprascapular notch. And if you come along the spine of the scapula and the glenoid process over here, put your finger here, you'll find another notch. The name of this notch can be spinoglenoid notch. Okay, so there are two notches, suprascapular notch and spinoglenoid notch. Okay, spinoglenoid notch. Okay, now there are two tubercles. Okay, it's not seen in this view, but there are two tubercles. One tubercle over here. Okay, it will be called as supraglenoid tubercle, and the one below is called infraglenoid tubercle. Infraglenoid tubercle. It's a very small projection. Okay, you can trace it just along the glenoid fossa. Okay, now let's move on. So in this you can see all the features. You can keep both and understand together. Let me quickly go through again. So we have three borders. Remember, what are they? Superior border. This is the medial border, which is close to the, like if you draw the center of the body, okay, from the back, this is the medial border, and this is the lateral border. Okay, then we had three angles. We said this will be the superior angle, this is the inferior angle, and this is the lateral one, which is covered by glenoid cavity. Okay, so it's called glenoid cavity. Then we have three fossas. Remember, supraspinous fossa, I said infraspinous fossa, and this will be the subscapular fossa. Okay, subscapular fossa. Okay, remember the name, SUB. Sub means it's below the scapula. Okay, and then three processes. So this will be the spinous process, also short form you can say spine, and it continues to form the acromial process, and then on the superior border you will trace for the coracoid process. Okay, so you can see the coracoid process well here. Look at the coracoid process. Okay, that's the coracoid process. This is the acromion process. Okay. Next, this region is also called as the neck of the scapula. Okay, and let's move on. So here we can see how it articulates with the humerus and clavicle. So it articulates, that is, it forms a joint. The glenoid cavity will articulate with the head of the humerus. This is called the head of the humerus, and it forms the shoulder joint. Glenoid cavity of the scapula articulates with the head of the humerus to form the shoulder joint. Okay. Then the acromion process, remember this one? Acromion process of the scapula will articulate with the acromial end of the clavicle, to form the acromioclavicular joint. So these are the two joints which are formed by the scapula. Okay. This is another view. So again you can see all the details which we had just mentioned. Anterior view. Now I will go into the humerus. I'll start explaining about the humerus. So the humerus has three parts. We can say this is the upper end. This is called as the upper end of the humerus. This is called as the shaft of the humerus. Okay, and this will be called as the lower end of the humerus. Okay. So in the upper end we have head. This is called as the head of the humerus, the one which articulates with the glenoid cavity. It's called as the head of the humerus. Okay. Then we also have neck. Now there are two necks. There is anatomical neck and there is a surgical neck. Anatomical neck and a surgical neck. Okay. How to identify? Can you see the black line over here? This line. Okay. This is called as the anatomical neck. So anatomical neck is between the head of the humerus and two tubercles. Okay. This projection is called as greater tubercle, and this projection is called as lesser tubercle. So anatomical neck is between the head of the humerus and the two tubercles. The surgical neck, this black line. Okay, the surgical neck is between the upper end and the shaft. This is called as surgical neck. So there are two necks for the humerus: anatomical neck and the surgical neck. It's very important. Okay, the surgical neck, I'll tell you the point of importance. There is a structure which is called as the axillary nerve. It lies here, and if there is any fracture of the humerus, this nerve may get injured. Okay, so it is the axillary nerve which can get injured. The axillary nerve supplies the deltoid muscle, and it will cause symptoms related to it. Okay, now between the two tubercles we have intertubercular groove. So between the two tubercles, can you see some kind of a depression? That is called intertubercular groove. So that's all about the upper end. Okay, it has head, the two tubercles, greater tubercle which is lateral, medial tubercle which will be which is also called as the lesser tubercle. Okay, then we have okay, in the shaft you can look for the intertubercular groove. So this has another name. It is also called as bicipital groove. Later on you will study the muscle which passes through here, or the tendon of biceps, long tendon of biceps passes through this. So it's called bicipital groove also. Okay, now coming to the lower end. Now we should go in an order. remember always. So let's go from medial to lateral. Medial to lateral. So medially, it is called as medial epicondyle. Medial epicondyle. This projection is called as medial epicondyle. Okay, so remember this, like number 1, medial epicondyle. Number 2 is the trochlea. Number 2 is the trochlea. Okay, so medial epicondyle is number 1. This is number 2. Trochlea. Number 3 is capitulum. Number 3 is capitulum. Okay, so this is capitulum over here. Capitulum of the humerus. And the lateral most, it is the lateral epicondyle. Lateral epicondyle. So remember this as number 4. So from 1 to 4, what are they? 1 is medial epicondyle, 2 is trochlea of the humerus, 3 is capitulum of the humerus, and 4 is the lateral epicondyle of the humerus. Okay. Now coming to fossas. Okay. So just above the trochlea, look for a fossa. Fossa is again like a small depression. This is called coronoid fossa. It is called coronoid fossa. Above the capitulum, it is radial fossa. Above the capitulum, it is radial fossa. Okay. There is one more fossa in the posterior aspect. It is called olecranon fossa. Olecranon fossa. Okay. So let's move on. Again, look for the head of the humerus. I would like to tell you some points of identification. So if the head is facing medially, head should be facing medially, okay, and the head has to be proximal, so it has to be on the upper part. Okay, so this is the proximal part, and the olecranon fossa, which I'll show you in the next. Olecranon fossa will be facing posteriorly. Olecranon fossa will be facing posteriorly. So these are the points to identify that it is belonging to the which side. Okay, so now this belongs to the left. Okay, this belongs to the left side. Okay, so here you can see the head of the humerus, and this red line here will be the anatomical neck, and here it will be the surgical neck. Okay, and I told you the nerve which is related, it is the axillary nerve. Axillary nerve. Okay, and from in the lower end you can see all the 4 structures. Medial epicondyle, number 1. Number 2 was the trochlea. Okay, and then the capitulum, and then the lateral epicondyle. Okay, so in the posterior aspect, again you can look for the head of the humerus, the anatomical neck. Okay, this is the surgical neck, same, and you can again look for all the points which I just told you. And this is the olecranon fossa. Olecranon fossa. So the humerus has 3 fossas, 2 anteriorly, which is the coronoid fossa. Then you have radial fossa, and posteriorly you have the olecranon fossa. Okay. Okay. Now let us look. Okay. Here also remember the posterior aspect. There is another nerve involved here. Okay, there is a groove over here, and it's called as the radial groove, okay, or the spiral groove, and the radial nerve will be related here. Okay, so the radial nerve will be seen here in the posterior aspect. Okay, and along the medial epicondyle, okay, along the posterior aspect, the medial epicondyle, there's another nerve. It's called as the ulnar nerve. Ulnar nerve. So here you have ulnar nerve. Here you have the radial nerve along the spiral groove. Okay, and along the surgical neck you have the axillary nerve. So there are 3 nerves which are involved. Okay, and one of the commonest fracture is supracondylar fracture. Okay, supracondylar fracture. Okay, so remember the medial epicondyle, right? So if there is a fracture, it is called supracondylar fracture. Okay, fine. Next. Okay, now coming to the bones of the forearm, we have a medial bone, okay, and a lateral bone. The medial bone is ulna. Medial bone is ulna, and the lateral bone will be radius. Lateral bone will be radius. So this is radius over here, and this is ulna. Okay. Now you can see that the radius and ulna forms joints. Okay, you can see that they form joint over here. So this will be called as the supra radio ulnar joint. This is the inferior radio ulnar joint. Okay, superior radio ulnar joint and the inferior radio ulnar joint. Okay. Okay. Now looking into the details about ulna. So ulna has olecranon process. This is the olecranon process. Okay, and this is the trochlear notch. This is called as the trochlear. Number 2 is the trochlear notch. Okay, then number 3 is the coronoid process. This is called as the coronoid process. So there are two processes, olecranon process and the coronoid process. Okay, and there are two notches, the trochlear notch between the olecranon and the coronoid process, and the radial notch. Okay, the radial notch between the ulna and the radius. Okay, upper end of ulna and the radius. So that is called as the radial notch. Okay, and in the anterior aspect you can also look for ulnar tuberosity. Ulnar tuberosity. The membrane between the ulna and the radius is called as interosseous membrane. Interosseous membrane. So along the border, that is the lateral border of the ulna, and it will be the medial border of the radius, it is called as interosseous border. Interosseous border. It will be a sharp border which helps in forming this, giving attachment to this membrane. Okay, and then you have styloid process. Okay, this is styloid process in the lower end. This is called styloid process of the ulna. Okay, and this entire thing is called as the head of ulna. Head of ulna. Head. Okay, so the head of ulna is lower down, and this is the styloid process which is jutting down. Okay, now coming to radius. So this is called as the head of radius. Number 18 is the head of the radius. Okay, and then this narrow part is called as the neck of the radius. Number 17 is the neck of the radius. Okay, then number 16 is the radial tuberosity. Radial tuberosity. It gives attachment to the biceps. Okay, biceps muscle. And then you have also the interosseous border. Okay, same, the interosseous border. And then in the lower end is more broad compared to the ulna. Okay, the lower end of radius is more broad. And number 12 is the styloid process of radius. Styloid process of radius. So if you will compare between the two styloid processes, the styloid process of radius is at a lower level when compared to the styloid process of ulna. This can be palpated, and it's very common to have a fracture in the lower end of the radius. Okay, lower end of radius, there could be a fracture, and the name of this fracture is Coalesce fracture. Okay, if you have this Coalesce fracture, what happens is the styloid process of the radius can go to a upper level. Okay, it can raise up, and it may be palpated at the same level of the styloid process of ulna, or maybe even above that. So this is how they can externally palpate and identify the fracture. Okay, the Coalesce fracture. Okay, now moving on. So you can again see the ulna. So like I just told you all the features of ulna. How to identify site identification of ulna? You can remember that the olecranon process, like the one which is right here above, the olecranon process will be proximal. Olecranon process will be proximal. Okay, the trochlear notch, this is the trochlear notch, will be anterior. Okay, and radial notch. Okay, the radial notch will be, that will be here, the radial notch will be lateral. Okay, will be lateral. Okay, and this is the coronoid process. This is also called as the shaft of the ulna, and like we already told, this is the interosseous border, which will be the sharp border. This is the head of the ulna, lower down, the head of the ulna, and styloid process, which is projecting down. Okay, So coming to radius, so again you can look for the head of the radius. So remember, head of radius is proximal, whereas head of ulna is distal. And this is the narrow part, it's called as the neck of the radius. This is the radial tuberosity, okay, and then this will be the radial, the styloid process, and the lower end of the radius is quite broad. It is quite broad, okay, and this belongs to the left side, okay. How to identify? The head is proximal, okay, and the bicipital tuberosity will be medial. The bicipital tuberosity will be medial, okay, that's right here. And the bicipital tuberosity is also the radial tuberosity, the same. And there is a dorsal tubercle which is seen in the posterior aspect, okay. In the posterior aspect, you can look for a tubercle. It's called as the dorsal tubercle. Dorsal tubercle. Okay, now distally, okay, remember distally it will articulate with the bones of the hand, okay, and it is the two bones, scaphoid and lunate to form the wrist joint, okay. Okay, so here you can see all the carpal bones. The carpal bones, like this end will be the proximal, and this, as we go away from this will be called distal, okay. So proximally, like the carpal bones are arranged as two rows, okay. So you can remember there are 4 bones in the proximal row and then 4 bones in the distal row, okay. And then there are 5 metacarpal bones. The counting starts from the thumb, okay. So this is the first one, and then as you keep going, this is the last one, 5th one, okay. There are 5 metacarpal bones, and then there are phalanges. So each finger has 3 phalanges. The name of the phalanges: proximal phalange, middle phalanx, and distal phalanx, okay. Except the one related to the thumb, okay, the lateral one has only 2 phalanx, okay, 2 phalanx. So it will be called as proximal and distal. It is called as proximal phalanx and distal phalanx. So totally we have 14 phalanges. Okay, let's see the next. Okay, now let us learn the name of the carpal bones. So like I told you that there are 2 rows. So proximal row, you can go from lateral to medial, okay, medial. There is the mnemonic to remember the proximal row. So you can remember as: she looks too pretty, try to catch her, okay. She looks too pretty, try to catch her, okay. So what is S? She looks, the she is for scaphoid. Number 1 is scaphoid bone. Number 2 is lunate. Lunate means like the shape of the moon, so it's called lunate. Number 3 is 2, that is triquitrum. And P is for pisiform. Okay, so that is the proximal row. And like I told you in the previous slide, scaphoid and lunate articulates with the lower end of radius to form the wrist joint. Now again come back to the from lateral to medial. So number 5 is trapezium. Try to, so trapezium, then trapezoid, then C, that is capitate, okay. Capitate actually, like it's a captain, so it's a very huge big one, so it's called capitate. And the last one is called hamate, okay. So it has a small hook, so it's called hamate, like a hook, okay. So remember the mnemonic and try to by heart the names, okay. So again another view to see the bones. So here you can also see how it is articulating the lower end of the radius with the scaphoid. So this is the scaphoid, okay, and this is the lunate. Remember, scaphoid and lunate forming the wrist joint. You can also look for the styloid process of the radius, which is at a lower level when compared to the styloid process of ulna, which is at a higher level, okay. the other bones. This is the triquetrum, and then you have pisiform, and then the next row, which I just explained previously. Coming to the metacarpal bones, you have this will be the first metacarpal, like you start from the thumb, and then you go to the last metacarpal bone. Okay, so that's all for today. I hope you have benefited. There are 8 carpal bones. Okay, there are 5 metacarpal bones, and there are 14 phalanges. 14 phalanges. Hope you will see all these bones and try to see all the points what we just discussed today.